our final session of the day, which is panel session 3. It's titled Health Data Governance. Sorry, I had a brief network interruption. But it's been such a great day so far. I feel so inspired, and I'm sure you feel that way too. There's so many opportunities for digital health to help solve the healthcare challenges in Africa, and there and our final panel session for today highlights these opportunities from emerging technologies like artificial intelligence in healthcare and the importance of data governance and privacy. So let's engage actively in this session. Drop your questions in the chat and I'll ensure they reach our panelists. Remember to keep networking and stay tuned for this session. And remember, participants will get certificates of participation at the end. So to present or to moderate this panel session, I'm honored to introduce Dr. Brenda Kubeka, the Managing Director and Co-founder of Health IQ Consulting, South Africa, to moderate this session. Dr. Brenda Kubeka is a health professional researcher, entrepreneur, and health advocate with extensive experience in the private and public health sectors. She's the managing director and co-founder of Health IQ Consulting, specializing in clinical risk management research and healthcare ethics. Dr. Kubeka holds a medical degree from Medunsa, an MBA from Gibbs, and postgraduate certificates in clinical ethics and media and medicine from Harvard Medical School, where she pursued a master's in bioethics. She has held prominent roles, including Chief Medical Officer for a private hospital group, Chief Director for Hospital Services and Consultant, and has published extensively on health equity, ethics, and patient safety. She's an active leader in health advocacy, serving on the Social and Ethics Committee at CANSA, as Deputy Chairperson of the Board at COSASA, and as a member of the HPCSA's Professional Conduct Committee. She is recognized as an ALI Fellow. Dr. Kubeka has significantly advanced health systems, strengthening ethics and women's empowerment, including launching the Women in Healthcare Summit in 2022. So please welcome Dr. Brenda Kubeka to moderate this session on health data governance and privacy, the challenges and opportunities of artificial intelligence. Welcome, Dr. Brenda.
Thank you so much, and thank you for the introduction. I'm looking forward to our conversation this afternoon. So I'm just going to introduce our panelists, and and then for the delegates to note that one of the panelists will not be joining us, and also Dr. Muzere Kwayo, who is an AI sector lead at Vilbro Africa, will be joining us a bit late. So we have Dr. Raphael Akambe, Assistant Director at Lagos State Ministry of Health in the Office of Data Protection. We have Stephen Osewe, a technical lead for software and systems at CHISU, which is Country Health Information Systems and Data Use Program. We also have Innocent Chiboma, Principal ICT Officer Digital Health at the Ministry of Health in Zambia. So I am going to be naughty and not go through their impressive CVs, because those are available on the app or on the platform, and please engage with those. So we'll jump straight, because I think this is a very interesting topic or discussion, and we'll ask questions, each of them. And as stated earlier on, that please do use the chat functionality to ask questions or give us comments. We will have a session, or after the session, we will have time for a question and answer session to engage with you more. So our first question is to Dr. Raphael. What role should regulators play in setting the standards for data privacy in AI-driven healthcare solutions? And how can these regulators also keep up with rapid technological advancements?
Thank you very much, Brenda, for this opportunity to have this discussion with us. And I also want to thank Director Africa for this great innovation that they've just brought. I believe this is definitely going to bring a lot of changes into African digital health space. Concerning the question you asked, I want to start by saying that AI technology has really brought about a lot of changes uh, in healthcare, in Africa, in the world generally. And while it has really, brought about this innovation, a lot of advancement, development, there are needs to also look at other areas, which is very, very critical for us to be able to have the full understanding of the involvement of AI in the area of healthcare data privacy. Looking at the regulators now, the regulators play a very pivotal role in setting and enforcing data privacy standards in AI-driven solutions. And I would like to look at this area, I want to understand it in two different ways. Number one, establishing comprehensive framework, and also number two, ensuring adaptability to technological advancement. Now, what are the key roles of regulators? This is very crucial because when we have any technology introduced into the system, it is very important to have the rules and regulations that will guide the operation of those solutions that have been introduced. And the regulators have a very vital role to play. And I'm going to look at it from different perspectives. Number one, there's a need for the regulators to develop clear privacy standards whereby a well-defined, robust, and actionable guidelines for data collection, processing, and sharing of AI-driven solutions is going to take place. Number two, enforcing accountability mechanism is also another area the regulators need to really look at as part of their roles, whereby the requirements for organizations to implement accountability measures like impact assessments, transparency reports, and ethical audits, ethical artificial intelligence audits, is very, very crucial. Also, there's a need to mandate clear documentation of AI models, data sources, and decision-making processes for all this to be well, taken care of. Now, the next point I'm going to talk about here is going to be, as part of the role of regulator, is promoting ethical artificial intelligence practices, whereby establishment of rules that will prevent biases in artificial intelligence algorithm in order to protect user data and ensure fair treatment within the ecosystem. Also, there's a need to facilitate stakeholder discussion to bring the stakeholders together on ethical concerns that is going to foster on collaborating between the private sector, academia, and the society as a whole. Now, we look at this, we are talking about the healthcare sector now, but there's a very important need for us to look at the area of the academia as well. The collaboration with academia, because by the time, this is brought into the academic curriculum, sorry, when it is brought into academic curriculum, the student will have the better knowledge while they were in school. So that by the time they are graduating from school, they are already in the know of all that they're supposed to do. Now, the fourth one I'm going to talk about is about fostering data security. We know data is equal to life, and there is no how healthcare givers can perform any miracle, can perform any magic in the area of the healthcare of any individual without adequate data. Data is very, very important. So the fostering of this data security by regulators is very, very important by enforcing strict data encryption so that not everybody will have access to the sensitive data of patients. Data encryption is very important. The anonymization in the past last two sessions, where Yaya, and also Raphael, I think from Botswana, they talked about anonymization, de-identification of data, which is definitely going to give a lot of coverage to the identity of the data owner. That is talking about the data subject. Also, this anonymization is also very important, and secure data storage protocol. This is another very important area. There is one thing for us to collect quality data from patient. Another thing is for us to be able to secure this data in a well-protected storage condition. The establishment of penalties for data breaches also should be part of the roles of the regulators. The regulators should be able to, so that those who are practicing will know the consequence of breaching sensitive data. Lastly, I will talk about the providing clarity in AI-driven use cases, which is also very important. I'm going to round up now so that I can give other people a chance. Now, there's the need for a well-defined permissible user cases for AI applications, particularly in sensitive domain like healthcare system, finance, and other law enforcement areas. You agree with me that when it comes to sensitive data, healthcare industry has a very strong part to hold, because healthcare system is where we have the big data, the biggest data we can even think of. Research shows that healthcare has the very largest data to take care of. It is only the healthcare that you have the data of every individual from birth to death. Even after death, the data of that patient is still very, very important. So providing the clarity as regards the AI use cases is also very, very important. Let me stop there so that at least I can give others to also talk. Thank you very much.
Thank you. Thank you so much, Dr. Raphael. I think, what actually stands out to me is issues around accountability and the fact that, yes, we do need regulation, but we must also ensure that we don't stifle the adoption of AI and innovation. The next question goes to Stephen Osewe. What steps should be taken to protect vulnerable communities when adopting AI solutions from the global north? And what ethical standards should govern the use of sensitive patient data in AI?
Yeah, thanks, Brenda. Thank you so much. And I think great points from Dr. Raphael. And one of the things that I want to throw back to Dr. Raphael, maybe when he gets a chance, is there's a thin line between innovation and regulation. And if we look at the emerging of technologies, we realize that regulations also always comes after the innovation. So as we seek to regulate AI, something to think about the thin line between the regulation and the innovation. Too much regulation stifles innovation, and too much innovation also stifles regulation. So I think that's one of the important areas to think about. Yeah. So to the questions, what steps should we take to protect vulnerable communities? Dr. Raphael has talked about some of those steps, but some of the areas I want to highlight is as you do your AI research, as you do your AI modeling, it's very important to include the local voices and the local context. So what do we mean by this? You need to engage the users, you need to engage the data subjects, and also each culture has some sensitivity. So you need to alive to these facts. One item in a community or in a certain culture might mean well, and in a certain culture it might be totally opposite. And I'm speaking this from the knowledge of Africa. So even things like colors, they are perceived differently in different communities. So having cultural sensitivity is very important. And then you need to develop a user-centered kind of approach. If you're going to build the models, you need to have a user-centered approach. So user-centered approach means your data subjects or your users become part of your modeling process, so that you don't design tools on your own and then come back to bring to them. So second thing I want to talk about is the data sovereignty and privacy. As you realize, we talk about AI regulations, but we do understand that we have each country now, most of the countries, let me just say that most of the countries have their own data protection policies, have their own data protection rules that have been implemented in their countries. So as you do your model, and in regard to this, even though there's no clear regulation in AI, you need to respect local laws, and also you need to respect the local data protection policies. Some of them have been raised, like encryption, so you need to implement that. So the patient identifiable information, you need to be aware of that, and then you need to minimize bias. So that happens a lot with a diverse set of data sets. So coming back to PII, there's a concept called data minimization. So basically, if you don't need my name, you don't need to pick it. So you minimize as much as possible so that you only have mandatory data sets that you need to have. Then the other point I want to talk about is this question that has been raised about ethical AI practices, and also such things like how do we know that the AI is telling us the truth? How do we know that AI is truthful with us? So we need to be cognizant of these factors. We need to look at impact assessments. We need to look at accountability mechanisms of all these things that you're doing. So a good thing, a good point I raised from a previous conference we had is if you're going to do a model for patients, so let's take an example. You're modeling prediction of TB drugs using an AI model, and then you get a 70% threshold accuracy, or you get a 60% threshold accuracy. And this says that this facility needs about 200 tablets. That defines the 60%. So basically that means if it is 60% accuracy, it's further from the true demand for that facility. So basically that means that facility is going to get 40% less of the drugs that are required in that facility. So that means some patients are going to miss drugs, and it's going to affect their continuum of care. So this means that we need to define these thresholds, especially where patients are involved, which is where AI sensitivity or ethical practices are put into focus. We need to be very clear in terms of what is the threshold, especially if I'm dealing with patient health prediction. I'm predicting maybe death. I'm predicting patient. I'm predicting patient going. Really need to define. So that we need to really define the level of the threshold that we can say if the AI hits 90% or 99% when it involves patient, then we can take it to the next level. So lastly, we need to look at sustainability and exit strategy measures for the community. Again, you don't want to build a model, support the community, and then when your program ends, it's all gone. So they are back to where they were. So this basically lets the community avoid dependency by you putting sustainability measures that is going to, if the model is a good thing and is supporting the vulnerable community, then they can continue with it without suffering with your exit. Then you can prioritize the steps on adoption. So you can actually prolong the adoption steps if funding or the future of that modeling of that AI solution is in jeopardy. You can prolong it so that it's a stepwise approach in terms of adoption and sustainability.
Thank you. Thank you so much.
And back to you, Brenda.
Yeah, I really liked, what you mentioned about elevating the voices of the end users. And it just reminded me of nothing about us without us. And I'm actually excited that we're having this conversation from an African perspective to make sure that, our uniqueness and the cultural diversity is also, built into the solution so that they're inclusive and accommodate or embrace all the different diverse groups that we have. The next question is for Innocent Chiboma. What are some examples of successful AI healthcare initiatives in Africa, and how have they navigated data governance and privacy challenges?
Thank you very much. That's a very interesting question, and I think it relates a lot to what the other panelists were saying. But anyway, I'd like to cite just a few. Here in Zambia, there is a project, though it's not yet gone to scale, but there's a project by UNC where they are using AI in health facilities to scan so using untrained really not really specialists, but healthcare workers who are not really trained in ultrasound to be able to scan and get better results and for mothers, pregnant mothers. Now the AI is assisting them because they're not really trained in that particular skill, but it's assisting them as they scan using this handheld device for the ultrasound, and they're getting very, very good results. There are also a few other projects where AI is being used, especially in the area of imaging. So for diagnosing TB, where they're getting a lot of success. And I think across Africa, I think I may have seen or heard of at least 3 or 4 or 5 other countries in Mozambique, in Kenya, in Uganda, probably where they're doing that. And I think generally this is a trend that we've seen where models are trained on certain images to really be able to pinpoint and diagnose that sickness. However, I believe that for Africa, one of the things that we need to do as a continent is to collaborate more in this particular area, because our needs are unique. Our everything is unique. It's unique to us, and the solutions that we are usually getting are coming from the global north, I think, as somebody may have mentioned there, and the data that was used to train those models does not very much relate to us. And so I really believe as a continent that one of the things that we need to do is to really collaborate in this area of artificial intelligence, and also building proper regulations on the ground, and being able to build capacity at country level. Earlier on in the morning today, I was part of a discussion with one of the neighboring countries where we're talking about trying to build capacity and collaboration in terms of even sharing our data lawfully as countries, in order for us to be able to train our AI and build innovation in that regard. So this calls for collaboration between governments, collaboration universities, and implementers like ministries of health, so that we can be able to obtain better results in our AI. Thank you. I think maybe I can stop there so that I can allow some comments on that.
Okay. No, thank you. Thank you so much. And so relevant, because we know that we practice, some of us that are in practice, in an environment, in a context where there is resource constraints. So technology and AI solutions can actually assist in expanding access to care, early diagnosis, etc. Thank you, Innocent. So we'll go to the second round of questions and then Q&A. So Raphael, I just wanted to find out, what is your opinion with regards to accountability, specifically for the innovators? I mean, we saw during the pandemic that, innovation related to COVID-19 came from everywhere and anywhere, and also not involving the clinicians in those processes and the planning or design. The question is, the accountability mechanism, should they also look at innovators? And how do you see that, panning out, or what's your opinion with regards to the innovators also taking accountability for harm maybe caused by their solutions?
Okay, thank you very much, Brenda. Taking it from where, very vital area that you touched, that the aspect of during the time of COVID-19. We all know that COVID-19 brought about a lot of changes to technology in the world, not only in African continent. And of course, it is very, very important, when it comes to the uh, the the way the data is being captured, by the healthcare givers. This is very, very important. And the area of innovators now, the area of accountability by the innovator is a very critical area that we need to really look into, because when innovators are coming in to bring in their solutions, to design a solution, there is a need for a proper regulation that is going to guide them in order for them to be able to follow the right direction, right? I can recall of during the time of after the COVID, a lot of developers came up with different solutions without any guide, without any regulation. They were just bringing in solutions. They were importing solution into African continent without any proper guidance. So, and this is causing a lot of error in our system. And this is the reason why the regulators need to really, sit up and do what is expected of them to do. Because without, the regulation that we are talking about, there is no how we can have the right result in the African continent. Like I said earlier on, there are so many people that are coming in with different solutions, with different technologies now, but there is no proper framework. There is no proper guideline to do it. I will just make a reference to the development that is going on in Nigeria presently. The Federal Ministry of Health, a few weeks ago, there was a call for some stakeholders to work on the development of the framework for telemedicine, right? And a lot of people came around to to bring in their ideas on how to develop a proper regulation that is going to guide the system in the country, right? This is part of what is expected of the regulator. And of course, when all this is in place, there is every possibility that innovators will have no choice but to key into whatever the regulators has given in order to give proper account of whatever they are doing. A lot of things are going on, like I don't want to mention, the particular, organization. They are much more particular. Let me just, it's the government setup anyway. They are much more particular about, what is happening to our data. When people come in with different solutions, now, where do you keep my data? We don't know where our data is going into. So yes, we have a lot of vendors, we have a lot of people coming in, but we don't know where the data you are collecting from us is going to. So this is part of what the regulator is supposed to be doing, and to ensure that proper accountability is taking place for everything to work according to the way it should. Thank you.
Thank you. Thank you for highlighting the need for the legal and I suppose ethical guardrails and the importance also of having responsible innovation where the risk and benefits, get balanced so that we minimize harm to our patients or to the society. The next question is for Dr. Mzri Kwayo. Welcome, Doctor. How can the benefits of AI in healthcare be communicated to the public to increase trust and acceptance of AI-enabled solutions?
Thank you very much, Dr. Brenda. And I'll build my point based on the previous speaker who spoke about regulations. Most of the time, the society accept products which have FDA approval or when it have like CE mark and those kind of things. So that's the first thing. Most of the time, when you go to a hospital, a particular machine was certified, we are comfortable with that. So that's the first basic thing. But let's not forget the gap that is already existing in the AI regulations and the policies. Now, when you go to the hospital to get data sets to train your model, most of the hospitals, you find out that they're a bit resistant on sharing data because of the privacy and those kind of things, because we don't have guidelines, we don't have policies on how to share that data for any use. It's not clear. So most of the time, it's like, who knows who? If you have some connection to the hospital, that's when you can have data set. But if you don't know anyone, it's very difficult. So the policies, we should have the guidelines on data sharing and those kind of things. The second part is on regulations. Many healthcare regulators on the continent, they're not well equipped with the AI technology. They don't understand it. I'll give you an example, and I won't mention a particular country where we went for an AI to get a regulator approval. And one of the things which we were asked is to provide a room, because whenever they are regulating medical devices, you have to provide the dimension of where that particular device was manufactured. So we were asked to provide the dimension of the room where that because a software is regarded as a medical device also, if it is used in hospital. So we were asked to provide the dimension of the room where this algorithm was manufactured. But it was developed in a computer. So which dimension of the room should I tell you? Another requirement was you're supposed to give them a sample to test it before they release it. So it's an AI algorithm in a computer. So which sample will I give you to test? So you look like they're still relying on these old ways of regulating medical hardware devices, but they're not yet equipped with AI. So we'll be delaying on getting the benefit of these products unless we change our regulation. Another point that I will also like to stress on is that when you go to the hospital to get this data set, it is difficult. One of the major challenges are they tend to not to have a long history of data. Many hospitals, they don't have servers for data. So it's like everything is stored in a computer, which will be deleted after 6 months. If that computer gets full, they just delete the data. So the healthcare practitioners, they have not been well trained or informed or educated about the importance of data, that it is not just for clinical use. This data can be used for training this AI algorithm and those kind of things. And the last part on the regulation is when we have this framework, the regulations, even in these innovators will follow these standards. Many countries, they don't have the standards to know if an AI algorithm reaches a certain particular test and it have passed, then it can be deployed in hospitals. I remember I was involved in one meeting by the WHO and the ITU in Cameroon a few years back, I think 2 or 3 years, in which the WHO is trying to develop what should be the global standards for an AI algorithm to be used in hospital. My worry on that is the WHO, the ITU will set the standards according to the labs in the global north, which are well funded with a lot of money. So we'll end up using products which are developed from the global north, which doesn't reflect the realities in our continent. So us as African, I'm shouting out to the African Union, to the Africa CDC, to make sure we develop our own standards. Otherwise, we'll end up using solutions developed from the global north, which doesn't really address the problems that we are having on our continent. I submit.
No, thank you so much. And highlighting again the importance of having a regulatory framework and having the standards. But I think what is actually stands out is the fact that innovation is moving faster than the regulations, but this compounds the problem because of the lacking understanding of AI by the regulators who are supposed to be making the decisions. Thank you for that. And so we move to the second round of questions before we open the floor for the delegates to ask questions. The next question goes to Innocent. So you mentioned, you gave us an example of a case study of, the use of ultrasound, and obviously having the technology, increasing access to early diagnosis and etc. So, but there's also a risk of when we use certain AI screening tools that will increase the number of people that get, diagnosed with a specific condition, where in that context, maybe there is not enough capacity to actually respond to the health service demand that has been created by the AI tool. So how can we strike a balance between, exploiting all the benefits that you can get from AI, but at the same time, not, increasing anxiety and, and the impact of knowing that you have disease X, but there are no expertise in your area to actually attend to you as a patient?
Thank you very much. I think what we probably have seen is the impact of late diagnosis is what's really been detrimental to the healthcare system, not necessarily the early one. For instance, for I think I'd speak for a lot of African countries. A lot of cancer cases are really diagnosed late, and the treatment is expensive. The equipment is, we don't have enough equipment for cancer treatment in a lot of countries. Whereas if some of that diagnosis with the aid of AI was done earlier, it is possible. For instance, I believe that it's interventions in prostate cancer and breast cancer, if they are done much earlier, they'll obviously be cheaper and would probably even save the life than when it has gone on to other stages. So I think it would be the other way if we're able to diagnose diseases faster. We probably can be able to plan for them better, as opposed to seeing them when they are really, really fully blown and at the very late stage. So I'm really thinking that we can actually even use AI to prevent certain stages of diseases. And even when you look in the area of public health, I really believe that just the use of AI there can be able to help us to prevent a lot of cases of a lot of diseases that will end up being epidemics just because we were able to use AI. So I really believe that is a good thing for us to be able to work around, so that we can be able to utilize the technology that is there, the technology that is there, the data that we've been collecting, the brains that we have of innovators, of developers will be able to develop tools that will be able to, for us to be able to use even in a resource constrained environment that we have, as opposed to not really doing it because we're afraid that it will create anxiety when we diagnose too many people. Thank you.
Thank you. Yes, thank you. The next question goes to Stephen. Would you please share with us maybe some practical strategies on how to elevate the voices of the marginalized, to elevate them when it comes to, the design, implementation, or deployment of AI solutions that are targeted at, the health problems that they experience? Okay, I think we've just lost Stephen.
Yeah, can you please confirm?
Yes, I can hear now. Yes, your line was breaking a bit. We can hear, I think, yes.
All right. So, yes, sorry about that. Yeah, so thanks for the question. And I want to allow me 2 minutes to digress a bit. And in these 2 minutes, I want to talk about two things that are very important before we talk about regulations. And of course, I am a pro regulations, but we need to not over-regulate, as is the practice in Africa. So we have governance, which should be a very critical thing in our MOHs. So when we talk about governance, we talk about rules and regulations. So think like data security and privacy should be already in place within the MOHs or within the governance infrastructure of how different countries are set up. Things like data sharing, and practices should be already in place by now if you're talking about AI. And things like, a facility data sharing arrangement and data use and all these things should be already in place by now, because I think in Africa, we've been doing this for so long. And I think certain building blocks like governance, infrastructure should be already in place. And we should not be talking about. So when you talk about AI regulations, data sharing should be already, we should be benchmarking on already what has been developed, because data sharing almost takes the same route. And then second is data quality. When we still talking about data quality, we cannot talk about even building AI models, let alone talking about regulations, because poor quality data, I know different models say that they are agnostic to the data noise, but in practice, this is not true. And we'll find different models are affected by data noise. So if you're still in your country talking about data quality issues, then you're still not ripe to talk about AI, because the models will not work. Or if they work, they will be far away from the accuracy level that will be required. And then third is the threshold. As we try to determine our own thresholds and try to call on Africa CDC and our own government to set up threshold, we need to remember that we also work in an international community, and our patients are moving from one region to the other region. So as we set up our own standards, we need to benchmark with the international standards as well, so that when we move, you've heard about the international patient summary and the push to be able to move records from one country to another country. So as we set our own benchmarks, I know these are the conversations that have been ongoing. We need to just be aware of the standard, because the world has become a small village nowadays. Okay. So on to my point on the question, and I just need to say that. So yeah, so the use of sensitive patient data in AI requires adherence to ethical standards, as has been eloquently put by other panelists. Requires adhering to privacy of the patient, the safety of the patient, and the fairness of the patient. So these are very important principles that we need to strike a balance when we are talking about the healthcare ecosystem. And this is the reason why I brought in governance, because my understanding is governance is like the prefect for technology. Without governance, then technology can really go crazy. So governance at the lowest level becomes the prefect. So to elevate these voices, we need to first consider the privacy and the confidentiality of our participants. I mentioned about data minimization. Let's collect only what we need, so that we don't have too much information that we don't use, And if there are data breaches, then we expose our patients, we expose our clients or data subjects to unnecessary, data breaches. Then anonymization and de-identification. This has been talked about as one way of providing the safety. This is where encryption comes in. This is where, putting of pseudonyms so that you are not able to back identify a patient or a data subject. Securely storing this data. So as my colleague was saying, they were being asked about the dimension of the room. I would assume they'll ask, what kind of technology are you using to protect this data? What is your encryption protocol? Are you using a private key? Are you using a public? And I really do agree. And this could be lack of knowledge or lack of skills, but I would at least believe this would be the question. Then the other areas that you can focus on right now is informed consent. At least when you take my data, I know what the data is going to be used for. There's transparency. There's also voluntary participation. You're not forcing me, so that if I know that my data is going to contribute to the well-being of the society, and my data is going to be used to do maybe, oh, sorry, I was lying in the noise. If I know my data is going to be used for the good of the other patient, then I can be given an opportunity to volunteer myself, as a participant. Then also revocability. My voice, I need to be able to say no when I don't feel my data is not used properly. So in that consent, in that that I'm going to sign, I need to be allowed to say no when I need to say no. I need to be allowed to pull out when I want to pull out. So then there another point that has been raised by my colleague is, training the models in the north and then bringing them here. So that generally doesn't work. So how do we represent the people in a community, certain community that the model is going to support? Basically, that means the data needs to come from that facility. So we need to ensure that if we're doing a model in Kenya, for instance, in a certain village, the data comes from that village. Because again, based on, and maybe Brenda, you can talk more about this, the body is different and it reacts to different environmental factors differently. So we cannot fairly take data from the north and bring it here and force our clinicians and patient and say, this is what the AI model is saying, so we need to follow it. So I think for us to provide equity and fairness and also, kick out the biasness from the data, we need to ensure that we have proper representation of the groups that we want, and then equitable distribution of all these groups. So data ownership, sovereignty, we've talked about this. And again, this clings mostly as a government service, need to be spearheaded by MOH, or it needs to be spearheaded by ICT department or autonomous digital health institutions that are created in country, so that this is anchored in law on the basics, and then AI regulation can build on top of it. Because if you want to build a whole new regulation for AI alone, then it beats the logic on the regulations that have been set up as a base. So we don't need basically to start from scratch, but build on what is missing to take care of AI. That makes it faster and even easier because we're already interacting with some of these regulations. Africa CDC has regulation, East African community has regulation, and I'm sure many other blocks within Africa have their regulations that they have set up that allows for these systems to be built. Like now, there's the digital sandbox that is being built by the Africa CDC. And the whole point is to allow the people in Africa, developers in Africa, to test their models. So that's a good way. So if your model passes there, then you're sure that if you go to any other country, you're not going to break any rule, you're not going to break any regulation, you're certified. Yeah, so let me stop there for the risk, not running the risk of taking too much time. Yeah, I'll give it back to you.
Great. Thank you so much. Fidat, I think you can assist. Should we move to the Q&A session now? Okay, thank you. I think we have questions or comments on the chat. So I'm just going to go through them. So I'll start with Fidat, do you want to come in? Oh, okay. So I'll start with Olamide. Do excuse me if I butcher your name or your surname. That's the diversity of this continent. So the first one is, how can governments and stakeholders ensure that rural communities are included in the development and deployment of AI-driven healthcare solutions, avoiding risk of deepening healthcare inequalities? So I will ask any panel member to respond to that, although I think we did cover it briefly. Not briefly, we did cover it in our discussion, but if one of you can respond to that question.
Maybe I can quickly just add one more thing that I missed, and maybe my other fellow panelists can add. One of the things that the government needs to do, like any other system, you need to sensitize the community so that they're aware of what is coming, they're aware of what they need to do and how this AI is going to help them. Then you need to have champions within the community that are able to, if they're able to explain this in a language that the community understands. Like I said, different communities have their norms, have their ways, have their, even if they're governments, if you go to different communities, there's a level, and these are historical, a young boy cannot go talk to the old man, a lady cannot talk to the old ladies. So you need to understand all these environmental factors that can inhibit your, can support the behavior change so that you're able to articulate this and it's well accepted, and then you'll get the support that you need.
Yeah. Thank you. Thanks, Stephen. Okay. And then the next question is, with AI systems relying heavily on data, how do we address the issue of bias or incomplete data sets that may not adequately represent the diversity of Africa's rural population?
Yeah. If I can respond to that.
Comment.
You can go ahead, Dr. Mzirokwa.
Okay, so basically, yes, there's a very huge bias in the data, and I'll give you an example. I was working on a breast cancer project, something which you have mentioned earlier. I was working on a breast cancer project and collecting that data set from Dar es Salaam. After the analysis, we came to understand that the model was not working the same with people from the down south of Tanzania, just because most of the people who were accessing the particular healthcare center that we are collecting data set from were people from the like the high end of living, the rich people in Dar es Salaam. So even the cases they are going to at the hospital were in early stages. But when you go to the down south of Tanzania, in which many poor people are, many of the cancer cases were in stage 3 or 4, so our model failed to work there. So the way to address that particular to the question that anyone developing the solutions should prove data that this particular solution has been tested in different parts of the country and it still works the same, with different edges, with different geographical locations, with different background. I'll also give you an example of another model that was developed from the Netherlands for TB screening. When that and the manufacturer of the developer of the model recommended that the way that model works, it gives a score from 0 to 100. The higher number we will have, the more suggestive TB it is. But when he recommended that scores from 50 and above to be positive. But when we tested it in Tanzania, we came to learn that the score should start from 30, not 50 as he recommended. So you can see this diverse, like you can take the example of COVID-19, that if we decide to do tests in Africa, we'll find a lot of people with COVID, but they still live a normal life. But for people from the global north, a certain stage can take them to be resting on bed. Take an example of cold or flu. We always have that, and people still walk around. People from the global north, we find them already on bed. So the government should make sure that any model coming in or being developed, it has been tested in different population of the country.
Thank you.
The contribution there.
Okay. No, go ahead.
I can go ahead.
Yes, you may.
Yes. So I think one from the example that we've heard from our previous speaker, I think one of the critical things that government needs to do is to ensure that we meet the basics. So in terms of AI is really builds on data. So we need to have the basics of things like electronic health record systems. Those are very important systems that need to be deployed nationwide using standards, so that you have a larger pool of data to draw from, which is very representative in its nature, as opposed to having pockets of deployments here and there. Because what that would do is that we will have some of those problems where we import solutions from abroad, like what was explained, and yet they are not going to work here. So it's, I think, very critical that the basics are met. So the basics of putting systems in connectivity, interoperability, very important. And I think, as we've already mentioned, the issue of the regulations, data governance, etc. So those are systems that need to be built and be very strengthened. And of course, that governance from the authorities, the government itself, they play a critical role in ensuring that there's sanity in the sector. And so that will help. That is a platform where the AI can now be able to build and be able to get the better results out of it. So it's not built in the air. It's really built from such foundations that we're talking about. Thank you.
Thank you so much. I don't see any questions.
Can I respond to the first question?
Brenda, can I?
Oh, sorry. Rafian, let me go ahead.
Okay.
My apologies.
Yeah, I want to respond to the first question. I think Stephen have really said a lot about it, talking about how we can reach out to the rural community in the development and deployment of AI, without any healthcare inequality. Or what I'm going to say is that I think it will be better if we can just adopt the kind of method that we usually adopt when we are trying to, share some certain information from primary healthcare level to the rural areas. They have a very effective, tools at which they use in communicating, and the same tools can also be used, though it's going to be much more advanced, to let people have the understanding. I'm going to start an example. There is a project I am presently, working on the eastern part of the country, on the laboratory management information system. Is a solution that we have developed, right? And it's an AI embedded solution. And what we do for the community to be able to have this understanding of what we have brought to them is that we went to the community leaders to share with them, to make them to understand the importance of this. And these are part of the method that can be adopted in ensuring that nobody is left behind in this area. Thank you very much.
Thank you. Thank you. Apologies for cutting you earlier. So the next question is related to the cliche that goes around, and it says data is the new oil. So if data is the new oil, so it means data is lootable and then also can be exploited. So what are these guardrails that we need specifically for our African context? How should we look at this? And also, so important for people to trust, that if their health data is held by the state, it is actually safe and used for the right reasons as well. So any panelists can respond. I see Stephen, you can go ahead.
Thanks, Brenda. I initially wanted to build on the important point that Innocent had mentioned about the EMRs, and I wanted to give an example of we did a model, and this model was run in 3 different facilities, and the source of data was the same EMR, and the level of accuracy was different in all the 3 different facilities. So that made us learn that putting the EMR or putting an electronic system is one thing. Consistently training and having the right workforce to collect that data is also another thing. So yeah, I just wanted to share that before we come into the new, so for the new question, I think I've heard people say that some countries are declaring their data as a national security asset. So I mean, when you do that, you know what that means. That every country now has a process that is required to manage that asset. But I would assume one of the best ways to do this is you need to have the data sovereignty. So one of the things we need to know is if data is coming. So let me give an example of Kenya. The health data is resident in the country. So any system that is coming has to show that the data will be available here. And for sensitive data like HIV, they are even hosted by a public health agency that has total control. If you want something, you ask them to give it to you. So those kind of smaller measures, I know some countries have even stringent measures. So those kind of measures can allow you to give people the confidence that their data is in safe hands and the data is used for the right purpose.
Any other comments from the other panelists? Thank you. I'm not sure if we've reached the end of our session, just looking at the time. So I'm just going to ask Faidot to advise us and check if there are any people who want to ask questions directly to the panelists.
So all the questions in the chat.
Okay. I don't see.
Can you hear me?
Yes, I can.
So all the questions in the chat have been answered at this point. But if there's one more question you want to ask, we have time for that. But if not, we can just with just maybe one final remark from every panelist, like about a line too long. Thank you.
Okay, no, great stuff. I have one question, and then from there we'll give the panelists an opportunity to make closing remarks. From my side, the question is, what is it that we need to do as Africans to elevate our voices in the global discourse of AI, specifically in healthcare?
Maybe I can start. So I think we don't know sometimes I think we don't know the power that we have in terms of the population that we have, the data that we've collected, the diseases that we've experienced, and the data that we have. And so, I mean, we need to use that position to elevate our voices and be able to speak as one, as Africa, and I think, for lack of a better word, demand what rightfully belongs to us. I think especially in the area, as I mentioned, and the others have mentioned, the issue of data. We have produced a lot of data, and which is used in a lot of universities, and people have done a lot of things with that data. That is really that's where we need to begin, and to collaborate as countries to be able to speak as one voice and be able to demand what really belongs to us. Thank you.
Yeah. Can I go on, please?
Yes, you may, and then Stephen after you.
Sorry, can I go on?
Yes, you may.
Okay, thank you very much.
You can go ahead.
Okay, can you hear me?
Yes.
Okay, yeah, to support what Innocent just said, I think we need to really understand and realize the kind of skills that we have as Africans. African continents have a lot of skillful people, very creative. And if we can leverage on that, it is really going to change the narrative in African continent. Instead of us relying on other people's products, we have well-trained, African youth that can come up with a very excellent solution that is going to speak to the culture of African continent. And with this, it is definitely going to help us to grow well in this continent. It's part of what I've been telling people that anywhere I go to, that African continent is coming with full force to take over the technology. Yes, this technology is not originally our own, but the rate at which we are going to really, overtake those people that gave us this technology, because we have the right skill, we have the right hand. All we just need to do is to manage whatever we have and build it up in order to get the results. Thank you very much.
Thank you.
Yeah. Thank you, Raphael. That was really nice. I like the taking over part. So, yeah, I think one of the things that has been mentioned, collaboration. We need to really take advantage of our youthful population, and I think that has been overemphasized enough. That Africa has the biggest number of youthful population, and we're going to have that for a long time. And this calls for universities to be more proactive in terms of even the AI courses that are being provided. If you see some of the content and compare that with the Global North University, you can see disparity already. So I think the universities need to share, the universities need to benchmark, the universities need to create courses that are relevant, that are practical. And then also one of the things that we need to perfect is how do we pipe back the innovations back to our economy, back to the sector. This was a discussion we were having with some universities professor in Nairobi the other day. We have a lot of thesis, we have a lot of PhD work that is based on AI, but it ends after graduation. So it does not find its way back, pipe its way back to the society compared to the Global North, where theses and the PhDs find their way into the economy. Yeah, if you find a lot of innovations are coming from people who are doing research. And this opens up to a bigger research, bigger companies. Most companies have come from that. So I think that is one area that we really need to focus on. And this requires, involvement of the government, involvement of the politicians, involvement of the population and the university council, so that there's a tight niche between producing these researches and then converting them to something that are useful and usable within our society.
Can I also respond, Brenda?
You can go ahead.
All right, thank you very much. I would like to resonate with Steve's comment. I think it came from Steve regarding regulation, that if we over-regulate, will actually kill innovation. I'm not sure if that comment came from Steve. I actually totally agree with that one, because I remember I saw, I think it was French president a few weeks ago, who was saying that now a lot of innovations are coming from the US and China because they're not over-regulating. But the Europe now, we don't see a lot of innovations because they have a lot of regulations. So I'll argue that we need to have these clear policies and guidelines so AI innovators can know the pathway, instead of just waiting for one product to go wrong, then the government starts over-regulating things and kill innovation. So it's better to have these clear guidelines as soon as possible to guide the AI innovators on the guidelines. And also the last point is for Africa, we need to have a uniform regulation, that for a product which has been registered in South Africa, you don't have to go through all the regulation process in Egypt, in Nigeria, that if it was accepted in South Africa, as long as you provide proof that it works, it doesn't cause harm, in Nigeria or in Kenya, it can work smoothly, instead of going all the process. Look at what Europe have, like the CE mark. as long as it is being accepted in Europe, in a certain country in Europe, it can be it can work in any other country. So let's have that one, and also let's not overregulate AI because it will seriously kill innovations here.
Thank you so much. This has been a very engaging conversation. So I am going to give you half a minute of closing remarks. From the panelists, and then we have actually reached the end of our session. So we'll start with Raphael, Stephen, Dr. Mzirikwayo, and then Innocent, in that order. Just the closing remarks. Thank you.
Yeah, thank you very much. Just as we have been saying, I think the other panelists have really made a lot of points. We have that population power, and we need to really capitalize on that. And just as Dr. Joe Gracia, sorry if I don't pronounce it well, said, there is a need not to over-regulate so that we don't kill the technology. We need to balance it up so that we also can have that better platform to operate well in the future. Thank you very much.
Thank you. Stephen?
Yeah, yes, thanks, Brenda. So mine need to say that AI works, but it's a double-edged sword. Like it gives you the benefits and can also, like take you to a wrong path. So yeah, thanks.
Yes, I totally agree with Stephen. Working in AI innovations for the past 14 years, I've seen AI projects failing, causing harm. Gladly, by the time when I was learning that, I was doing my PhD in Europe, in a lot of regulations. So those products didn't go to the market because when you go online, when you go, most of people just talk of the good side of AI. They never mention the other side when it can go wrong. They just say how good it can go. So let's also think of that way. This is why I'm insisting on regulations that to avoid these projects which will fail to cause harm. If you remember, Google fired one of their AI engineer because of the Sentinel thing. So AI can cause harm. Let's not forget that one. Thank you very much.
Thank you. Okay, no, thank you. I think we have covered everyone. And I'm hoping I didn't miss any of you.
I was missed.
Yes, the last, I think. Okay, you may go ahead.
Thank you. So I think just to agree, I think more than in any other sector, AI can cause more damages and a lot of backlash if not properly regulated. Of course, we shouldn't over-regulate. That's one. Then number two, as African countries, let's collaborate. Let's build the infrastructure. Let's build the platform. Let's build the ability to collect that data so that we can be able to be the AI champion continent that we're supposed to be. Thank you.
Thank you so much. So from my side, just to sum this interesting conversation, the importance of acknowledging and managing both the benefits and the challenges of AI, and the understanding that as Africa, we have the numbers, we have the capacity, we have the expertise, and we can also rely on the youth that we have as an asset, especially when it comes to innovation. And issues around data governance. It's a shared responsibility, and importantly, that we also don't, stifle in innovation when we over-regulate. And then lastly, it's the link between AI and the economic benefits of AI, especially in our context in Africa. And also, how can we harmonize regulations across Africa? I think that is a question we need to think about, and hopefully that we can have conversations or see some fruits of this conversation related to that. So thank you very much. I'm going to hand back to Faidat.
Thank you very much, Dr. Brenda. That was an amazing session. Thank you to all of our panelists. It was incredibly insightful, incredibly interesting. Thank you for shedding light on this critical issue. As our panelists said, AI has a lot of great opportunities for supporting digital healthcare development. But as they also mentioned, we need to also mitigate the risk and challenges that come with artificial intelligence. We need to find the balance between innovation and privacy, and also standardize our regulation across Africa. So thank you so much. That was an incredible session. Thank you. So that is our final session for day one of the RegTech Africa Digital Health Conference. Thank you so much to everyone that has been with us today. It's been a really long day, very interesting day. We got to connect with people from all over Africa and beyond. We got to learn, be inspired and envision practical solutions that will shape the future of digital health in Africa. Thank you to all of our sponsors, the partners, all the speakers, all the panelists for making today very impactful. And thank you to our audience for your active participation and engagement throughout the conference. So we're going to be back here tomorrow. And tomorrow we'll build on these discussions. We have sessions on digital healthcare infrastructure, expanding health insurance, and so much more. They will start promptly at 9:30 a.m. Nigerian time. So be sure to join us bright and early, and have a wonderful evening, everyone. Thank you so much.